the most commonly looked for antibody that we look for is called IgG, immunoglobulin G. There's also a second type called immunoglobulin M, which comes up a little bit sooner. But in general, you can start to see antibodies about 14 days after infection. Now, we don't know how long they last on the back end. What we do know from other coronaviruses like SARS and MERS and the ones that cause the common cold is that the antibodies in response to the infection can last anywhere from 1 to 3 years. But for this novel coronavirus, because it is so new, we don't yet know how long the antibodies will last. COVID-19 antibody testing at this point doesn't ensure that you're immune against COVID-19 because firstly, we don't know whether the antibody test being positive means you have enough antibodies to fight COVID-19 infection in the future. Secondly, we don't know if you have the right type of antibodies to fight COVID-19 infection in the future. And then thirdly, we don't know how long these antibodies last. Even if you do test positive today, how long would you be protected for? So you don't want to get an antibody test as a way to get an immunity passport or as a way to feel like you don't need to practice social distancing or wear masks during the pandemic. In one of the recent trials, there was actually, it was a randomized trial that was published that showed no significant benefit that was statistically significant, but the trend was in the right direction for people who got treated with the plasma. So really what we need are larger studies of patients in order to make sure that we have enough statistical power to detect a difference between the two treatment arms. Because the numbers look like they were going in the right direction, but we just didn't have enough patients to know whether that was statistically significant or not. So we need lots more people to actually donate plasma so that we can undertake these types of studies and really try to determine whether or not this is a viable therapy for COVID-19.